everybody, as we go live on the set here with Monica Caballeros. She formally introduced me to her real name. Monica, welcome to the show. I'm glad you joined in on us. And I won't need my headsets. I just want to verify that everything's coming through loud and clear. Welcome, Monica.
Thanks so much for having me. It's great to be back.
Oh, it's really nice to have you back. And so what I'm going to do is I'm going to kind of zoom in on you, and you're going to tell our audience what and who you are. Of course, you're Connect for Health Colorado, the official health insurance marketplace. Is that correct?
That's right. That is the fancy way of saying that Connect for Health Colorado is the organization for the state of Colorado that provides health insurance plans that have those benefits and protections under the Affordable Care Act, so sometimes known as Obamacare. And we are the only place then where people can qualify for financial help to make their private health insurance more affordable. So we work with the health insurance companies, the names that you know and recognize, and they offer a variety of plans of different levels. So you have the plans that have, low premium, high deductible, through the higher premium, lower deductible, the whole gambit. And essentially, you get to choose which one of the plans meets your medical needs, and then using a little bit of information about you, like how many people are in your household, your annual and current income, and where you live, we determine how much subsidies or financial help you can get that's applied directly to whichever of those health insurance plans you pick, and that's what makes it more affordable.
Go ahead and continue on.
Connect for Health Colorado is really the only place where people can get this type of financial assistance to make health insurance more affordable. So you can go directly to the health insurance company, but you won't be able to get that reductions in your costs. And with the pandemic, things are really, really tight financially for so many people. And so with that, before deciding that health insurance just isn't in your budget for this year, you can give us a call today or tomorrow, because tomorrow is the deadline, and we can help make sure that you are able to take a look at all the options available.
Nice. Yeah, you only gave me like 45 seconds.
I'm so used to doing these in different formats where I have to give a tight minute.
And I understand, because they take Zoom live instead. Like with us, we take Zoom peer-to-peer, and then we take the cameras live, which is really cool. Okay, let's talk to us about the free and virtual enrollment assistance that you have from the brokers and the community-based assisters. I'm sure you guys have that all set up and ready to go to help people if they can't take care of there's somebody there to help them.
That is exactly right. So Connect for Health Colorado, in addition to being this marketplace where you can compare and buy a health insurance plan and get financial help, offers a support network and an enrollment assistance network all across the state. We have dozens of enrollment centers, which is where in the before times you could go and you could walk in and get in-person help with your enrollment anytime during the year, not just during open enrollment. So, sometime in the middle of the year, you lose your job, you walk into a center, we can help you. And now they're taking virtual appointments, phone appointments, and so they're still there to help. We also certify hundreds of brokers all across the state who can also help you apply for health insurance and help you make the right choice about which plan is going to meet your needs based on facilities, there's prescriptions that you take, and how frequently you need care. So really, we have an entire network of help that's really here for people. Maybe if you don't like doing things alone, or you don't feel like you are or want to become a health insurance expert, but you want to make the best decision for yourself, or you simply just don't want to do stuff alone on the internet. I understand that. I like having a human being who can consult me, give me advice, who's an expert and can help me make that right decision for this year.
And the thing about it, open enrollment, we got a loud voice going through there for some reason. And open enrollment is for all the way through January 15th, Friday. Is that correct? So there's for the 21 coverage, right? And so the thing is an individual earning up to 51,400 or 40, or a family of four earning to 104,000 can qualify for financial help. Is that correct?
That is exactly right. I think sometimes people might, especially if they've applied for maybe a state program and have ever been told, oh no, you make too much money to qualify for assistance, don't assume that you make too much to qualify for help through Connect for Health Colorado. Income thresholds are pretty high, and so and the lower your income is, then the more help that you can get. And so really, yeah, don't assume that you make too much to qualify for this type of assistance that we offer.
And then there's something else here. What happens if they miss the deadline for enrollment?
Great question. So the open enrollment period to buy a plan for this year, as you mentioned, ends on Friday the 15th, which is right around the corner. But let's say, life gets in the way, something happens, or you're thinking, hey, I already have health insurance, but I'm kind of worried about not having it in the future. Am I going to get another chance? The answer is you have to have a qualifying life change event, which means that you lose your health insurance coverage from your job during the year. You get married or have a baby, or there is a loss, there's a death in the family. These types of events open up what's called a special enrollment period, which lasts for 60 days from the start date of that event that happened. And so you get a new window, and it's any time during the year, and you'll sign up for a new health insurance plan and qualify for the help through our marketplace. And if you don't take action right now, but you don't have a qualifying life event, the next opportunity that you'll have to enroll in a plan is the next open enrollment period, which starts on November 1. So all this to say, it is extremely important to make sure that you today or tomorrow are taking action, taking a look at the plans, and signing up if you can.
And that's very crucial. And you can sign up at connectforhealthcolorado.com. And then customer service center is 855-752-6749. And you can call them direct and get help. And like you said, you can do it over the phone too, right? They can ask you the questions and sign you up that way if you can't get down there. Or not down there, but go virtual and get signed up that way. I was almost saying go down there. Right. We can't go down there no more.
I catch myself all the time saying that. Go down there on the phone.
It's crazy. We're all in this matrix. They've stuck us all in the matrix. So we're all actually in the matrix now. And so, everybody's doctors are talking to their patients via, Connect for Health and all these different variables. They do it all virtual now. It's crazy, but that's what's been going on. Now, one thing we want to touch on is the Native American community does not have a set time on January 15th. They can continue on and get it at any time. Is that correct?
That is 100% correct. And in addition to being able to sign up anytime during the year, you can actually change plans once a month as frequently. I don't imagine a lot of people do it. It's not always necessary, but if needed, there is a window where any time to change plans. And depending on your income, you could qualify for even greater what's called cost-sharing reductions. Fancy insurance jargon for saying that we make your co-payments, deductibles, and prescriptions, all those other things outside of the premium, we make those, it could be $0.
Because, Monica, it does start
costing protections and benefits.
It does start costing money.
apologize.
Yeah, it does start costing money too, because if you have to go see a specialist, there's a $50 deductible and all these deductibles that could be added on that it just is not affordable to a lot of people because they're suffering all through this pandemic, loss of job, loss of their business, loss of everything. It's like you could be down to zero and like, whoa, what am I going to do? And can't find a job, so there's variables here.
Absolutely. And when people think about making things more affordable, we offer more than just that premium, because what good is having health insurance if you cannot use it? So that's where those cost-sharing reductions come in and hopefully make those other aspects of healthcare a little more affordable too.
And Monica, because there's so much Spanish-speaking people that do listen to our broadcasting, and they feel good because we talk to them in Spanish. And what I'd like to do is convert all what we were talking to into the Spanish language, and I'll let you take the lead on that. Si quieres hablar conmigo en español, vámonos. Let's tell them about what we can do here in the Spanish language.
Ofrecemos mucha ayuda en su idioma, por teléfono, en línea y en nuestras organizaciones acreditadas, donde trabajan guías de cobertura de salud. Y Connect es el mercado oficial de seguros de salud para los habitantes de Colorado y es el único sitio que ofrece reducciones en los costos de un seguro de salud privado. Y ofrecemos planes de una variedad de compañías de seguros médicos privados, entonces tiene que elegir entre un plan de nivel bronce, plata o oro cuando adquiere su plan médico por medio de Connect for Health Colorado. Quiero mencionar que todos los planes que nosotros vendemos van a incluir servicios preventivos gratuitos y cubren los beneficios esenciales como las vacunas, hospitalizaciones y especialistas, por ejemplo.
Y los indios, necesita hablar pero los indios, some of them are Spanish, some aren't. And they do have Spanish surnames. So, remember that Native Americans can still get into Connect for Health Colorado at any time. And so if you're Native American and you're listening to this broadcast, remember, January 15th isn't the cutoff. For everybody else, it is the cutoff. Is that correct? Unless you have life-altering experience with your life in terms of, like you said, having a baby, sick in the hospital, something terrible happened to you that you couldn't make it. You have to, how would somebody go about proving that? They just have to show that they had a baby, or show something from the hospital that you were in the hospital?
Yes, the health insurance companies, after you're during the special enrollment period, they might send you a letter asking for proof of the qualifying life event that happened, and so they'll let you know what kind of documents are going to be acceptable to prove that this event has happened to you. I believe that during the public health emergency, which was announced in March and made retroactive to January 2020, I believe that a lot of the health insurance companies may have suspended some of the verification requests for these special enrollment events because we are in a public health emergency, and that makes things so much more difficult, and really to encourage as many people as possible to maintain and stay in that coverage. But yes, typically part of the process is that you sign up, you say what the event was, when the event happened, and then we send that information over to the health insurance company, including the cost of the premium, how much financial help is going to go your way on your behalf, and in the event. And so then they'll probably send that letter and ask for the information. Just like very important, they'll also send all of the information about the related to billing. And so after you sign up with Connect for Health, you can expect to get the invoice from the health insurance company that you selected, and then you make your payments to them, just like if you have bought from them directly.
And that's good to know. Now, Connect for Health of Colorado has been around quite some time and been doing lots of good things for the community. And you guys are really on it this year for some reason. And you guys are well noticed. I mean, you got out there and really put the word out there. And one thing I want to ask you about the pandemic. Everybody's getting the inoculations right now. They're getting their shots and stuff. Do you get a lot of calls for that?
We our customer service center that handles the enrollments does not do any of that type of work. What I can say is that, for example, when you have coverage through a plan through Connect for Health Colorado, because it has those kind of essential protections and benefits, part of that are the immunizations and in your shot.
And the vaccines,
just,
that vaccine that's coming out now.
The rotavirus vaccine, all your regular vaccines that you need and are part of that preventive care package.
Wow, which is nice.
And that's in a plan that at the ground floor and at the full level. So no matter when you choose, you can get that kind of coverage, and that's covered 100% by the insurance company.
And that's very nice to hear and know about, because right now they're moving quickly, a lot faster, and everybody's saying Joe Biden is coming in and speeding it up and trying to get this going a lot faster. We've been going through some trying times as a nation and dealing with what we're dealing. I just can't believe I think everybody is just sitting back saying, wow, and everybody's just trying to sign up for health insurance. Everybody's just trying to look for jobs, trying to get back into the mix of things. And Connect for Health Colorado doing a great job in getting your health insurance. So I'm going to give you that number once again. Jot it down, 855-752-6749. Just call them. It's 855-752-6749, and they will help you connect for some health for yourself. And then the website is connectforhealthco.com. That's connectforhealthco.com, which stands for connectforhealthcolorado.com, more or less. But it's not the full Colorado, just CO. So you can get up on the website and set up an appointment. Can you set up appointments on your website?
Yeah. So if you navigate over to the help section, we have a few different tools where you can put in your information, and you can have a broker who will call you and then kind of take it from there and set up an appointment with you. We really just need your zip code, and you can search, how. And again, everything is virtual and phone, so I guess the area isn't as important in terms of getting there, but maybe in terms of that, you'll have someone who understands what the plans are in your kind of, not get too policy wonky, but your rating area, which is
policy
kind of
wonky.
health insurance companies decide. I know, where all the health insurance companies get to decide, I want to offer plans, here, and here in Colorado, and some will say, I'll be over here, and here, and some are in every county. So all this to say that when you're working with someone who really understands, okay, if I'm looking between Anthem and Friday, like I know those 24 plans really well, and so they can help you narrow down, okay, what's the best. And even if you looked before, that's kind of the nice thing about making an appointment with a health coverage provider or broker, starting on our website and then connecting to them and figuring out if you want phone or virtual appointments. But we're just trying to make it as easy as possible for people to get connected, make appointments, and get signed up.
And I'm thinking, even when we get past this pandemic, I'm thinking just what everybody has done via Zoom, via virtual, I think it's going to change the complexity of the way we buy health insurance anymore. Because of the way we're doing it now, it's like, you Connect for Health Colorado, you can get online and get your health insurance set up, or via phone. And it may take the one-on-one personal kind of effect out of play. Who knows how it's going to change, right?
I think there's so many great questions about accessibility in what you just said, because you're right, like it does make it easier, maybe for some people who even, it's a lot of time for them to go drive, 30 miles to go meet with somebody, but, on the side, I do understand for certain people, maybe, I think it can make it maybe a little bit harder if you're already working with perhaps a language barrier, or some other type of barrier where doing things in person is just so much easier. It's really something big to noodle on, and I think it is going to change a lot about how we maybe do our work going forward.
And if you just joined us, you're listening to KUHS Radio TV here in Denver, Colorado, with Monica Caballeros. And I got that right this time, didn't I? And she's with Connect for Health Colorado, and getting you all some information and how to sign up. And you can go to connectforhealthco.com, or you can call 855-752-6749. and get yourself signed up. And you know, we talked about there's a lot of last minute people. It's like that for everything, whether it be the show, a concert tickets. Health insurance is the same way. Everybody like races to it, so they're going to be relatively busy. And it's kind of nice that we got on here on Thursday. Tomorrow's the cutoff day. Is it at 12 midnight tomorrow?
That's right. It's 12 midnight tomorrow. However, our customer service center, if you are looking for help over the phone, I believe that they will be closing at, I don't want to say this wrong. It's listed on our website. It's either 7 or 8 p.m. So I recommend getting as soon as possible today or tomorrow if you need extra help on over the phone. But if you're doing it online, you technically, yes, have till midnight. I suggest you start Saturday at 11 p.m.
That's really good. Okay, Monica, it's been nice having you on here on KUHS Radio TV. We had a reschedule, which kind of works out better for us, actually. And Monica told me the same thing, and I thought the same thing. You know, everybody comes in at the last minute. And a day before to tell you all about how to get health insurance, you can call 855-752-6749 or go to connectforhealthcolorado.com and sign up. And it's easy to migrate around the website. They've got it really simplistic in there. So if you don't quite know, you can call their customer service helpline and they can kind of walk you through it if you're not sure. And any last messages for everybody out there, Monica?
We talked a lot today, and a lot of jargon came up, and a lot of different rules. And if you are thinking, there is no way I can remember all of that, and I don't know what I qualify for, and I have all these other variables in my life, please know that just give us a call, and we're happy to take you through it. You do not have to be an expert yourself. You don't know to memorize the rules. Let us help you, and our experts help you. If you don't know what you qualify for, that's totally fine. We can double check and get you and your family members into Medicaid, into CHP Plus, which is the CHIP program for kids, or a plan with Connect for Health Colorado. So let us take the stress off, and all you got to do is worry about giving us a call tomorrow.
That's
so
awesome.
Get in touch. We're here to help.
Awesome, Monica. With that being said, we're going to say goodbye for now. Thank you for being part of our network here. It's always fun to have you guys on. I've really enjoyed working with Connect for Health Colorado, and we had the other gal on here twice. We've had you on here twice, and you got to meet not only myself but Paul Chavez. And there's a bunch of other ones that are on here that we could have had you on, but it only calls for so many because some of the other VDJs have their guests and everything set up. But we really enjoyed having Connect for Health Colorado here, and props to you, Monica. You're doing such a fine job. This is what you're into, right? Communications.
Yes, I've been talking about Obamacare for going on 8 years in here in Connecticut, and so I'll talk about it all day long. And please answer questions, and thanks for having me on.
Okay, bye-bye now.